So I'll call this GCTE meeting order and welcome to everybody. Make sure that you how are they doing their attendance?
There's a QR code that will display after the meeting. It was shown in the beginning.
Okay,
And then there's the attendance link on the Zoom chat.
did you hear that? The attendance link on the Zoom chat. There'll be a QR code at the end. There was one beforehand. Okay, and Ms. Grant, would you like to check to see if we have a quorum?
So I know we have Kelly and Kelly here, you and I, and Ashley's here for PI. What about Kendra? Are you on?
I'm here online.
All right, so we definitely have a quorum.
Okay. And Rayma, I think, is gonna try to call in. I don't know.
I'm
if you're-
on. This is Rayma. I'm on the call.
Hey, you made Ashley smile.
Crystal, are you on? I don't think she was gonna be able to call in.
Okay,
No, she's on another webinar.
okay.
She's on one.
All right, so we have a quorum.
All right, so now we need to approve the minutes from August 1st meeting that was sent out last week, I believe.
Miss Van Ness, we're only sitting on the first three rows. Would you mind moving up? So I'm sharing with you. I appreciate that, but would you move up? Because even Dr. Maderos moved up. So if she moved up, then you have to move up. Yeah.
I know. Hi, everyone online.
She is now moving to the front row.
And she's doing it very southern with a South shade. See what happens when you have too many surgeries in 1 year, you get real punchy.
It's gassy. I have to tell you about
So you either have surgery or you get injured. Yeah, you had a presentation about back braces and stocking those. And so maybe we'll have a thing about people stocking the walking boots for the walking needed. So,
Save me a lot of money if I could have done.
yeah.
Hot market walk boots.
I'm sure. All right, so back to the minutes. We need to approve our August minutes.
Can I get a motion?
Ashley,
I'll second.
Rachel,
Rachel, thank you.
any opposed? All right. The minutes are approved. So Miss Atkins, would you like to give an update?
I'm gonna use the mic because I'm sorry that my bag is changing, you guys. So just a couple commission updates, namely, well, first of all, I just want to say congrats to Gina on a great meeting today. I think it's fabulous. Some of the now, and it will be really good to see lots of changes you'll see with equip in terms of adding resources, et cetera, so we can really move up. So we're really on the precipice of something great here. So very exciting. So just a few updates. Our meeting is tomorrow at the State Office of Rural Health. So we hope you can join us. It is coinciding with National Rural Health Day, and we have a couple surprises in store, and we like to really make a huge fuss about rural since that's been our focus lately, and we can't do what we do, and the tertiary centers can't do what they do without folks providing that initial stabilization and transfer. So we thank all of you who are working hard out there in trenches in the rural areas to make it all happen. We're in heavy prep for the legislative session. I know Gabby just sent out to you guys today. I'm sorry, that was my fault for not, after the last webinar, saying that I really wanted your finance KPI tools. So I know like December 18th is right before Christmas. If you really have heartburn with that, just communicate with me. The worst thing is like December, January 1st comes and goes and I don't hear anything from you. So What I'm trying to get is a little flavor of how much folks are struggling. We already heard the issue about how Georgia Medicaid does not accept the type 5, and luckily, we have partners now in DCH. We can work with that, try to figure out, because if you're not able to use type 5 for Medicaid, and then you're using another type for your private payers, you may or may not have success with getting paid. So we need to really leverage Val and her expertise and go have a discussion with Georgia Medicaid about, these are the rules, you guys, in the nicest way possible, you guys need to come into compliance with the rules so that we can make sure that folks are optimized for their bill. So anyway, I really would like your KPI. And again, it's just that sample of 20 patients or whatever you want to do or whatever you can do. Because the other thing is after the start of the year, we're gonna have another conversation with Val and probably 2 more webinars for your finance folks and you to then move on to the claims side to find out what level of success you're having with getting, with just the yes or no. Again, I don't want to know how much you're charging, how much you're getting. You probably don't know how much you're getting. You just know on the claim that they say yes or no, they paid for it. So the most important thing is to educate the legislators that no, you're not getting rich off these things. I think there's a perception out there that there is a huge reimbursement on this, and I just do not believe that's the case. Well, we know that's not the case now, because of the type 5 situation. So, obviously most of you guys who are here in the room were here, for Gina's or for the GQuIP day. You heard about our rural resource needs assessment, which was really eye-opening, and we brought those results back to the stakeholders who participated in the survey. And they gave us some really great feedback loud and clear, and we know we need to get some, like little micro educational, just in time kind of scenarios out to them. So I'm gonna be reaching out to a lot of you for help with developing that. We already have some things that we've piloted, and we probably need to tweak that a little bit. So that's also very exciting. A lot to come with that. And I also mentioned today that our registry startup grants, we've had some uptake on that, so that's really exciting. We can potentially get more interest in rural centers starting up and take away the burden of having to not only fund the data abstractor, but having to, now that the registry has gotten so expensive, take away that cost burden for them so that it's not a barrier and it's no risk. If you jump in and say, I hate this, I don't ever want to do this again, it's fine, we just want you to, dip your toe in and try it and see. And then I will ask Gabby to give an update. She has put together an amazing work plan to get us on track for FY 2026 PVP. So Gabby, if you can give the group an update on that group, please.
Yep, so we have 6 stakeholders in our PVP work group. They are reviewing the PVP criteria for FY 2026. They've met twice already. We're looking at outcome measures, looking at tiered criteria and the percentages allotted. So we have a couple more meetings, and then we'll send that out for an open stakeholder feedback comment period. And then I'll go to the finance committee and finally the Georgia Trauma Commission. So we're going through kind of checks and balances for the PVP.
What's the deadline for the next PBP work group deadline?
We had originally tried to do end of November, but we're going to extend that to end of December
Okay.
for the finalizing of the work group recommendations. And then maybe a 2-week open comment period for everybody else to provide feedback. Question? All right.
And dare I forget to mention that, back in September, Dr. Ashley El Jefe presented 2 papers at WST. I thought he was gonna need some Valium atomized in the room. That was very stressful. The economic impact of decreasing state trauma mortality on the lifetime personal income and state revenue. So that was the paper basically quantifying the return on investment for the trauma system funding that you guys all saw, because he started kind of bringing that data forward and looking at the and kind of quantifying it for the legislators in terms of if you save a life, every dollar you invest in the trauma system is essentially worth $22.60 return on investment. So trauma is an excellent investment. So that was basically the premise behind that paper. And then the second paper, the impact of ACS verification on a statewide collaborative, that one is actually moving forward in publication as improved stage, so that one should be released for publication very soon. We got all of our stuff back in for that, so we're just waiting for them to turn it around as approved. And so happy to see that green diamond up there today. Like, that was the first time. I said, we can retire now. It's over. It's done for us.
Just in time for the Christmas season.
Yes. Yeah, and then please make sure that you pick up the annual reports that Gabby took it all the way down here to Core Deal, because a lot of work goes into that, and it highlights the work that you are all doing. So take it back to your facilities and show it around so that they can see, because again, we don't, there's only 5 of us, so we can't do all the work. It's really, you guys are the volunteers and you're bringing it all across the finish line, and we appreciate so much for that. So please take that back and share all the great work that's been done. I think that's it. Unless there's any questions.
Thank you, Liz. Next up would be Marie and or Stacy, if you're on the line.
Hi, guys. This is Marie. Can you hear me?
Yes, ma'am.
Okay, great. Well, I just have a few numbers for you. All 36 of the 37 centers submitted their OTCP and OBCPE. All of the level 1s were 100% for the download, the OTCP being timely, the trauma surgeon response rate, and the record closure rate. So the level 1s are knocking it out of the park. The level 2s, they were 100% for the download and the OTCPE and the record closure rate, but their trauma surgeon response rate dropped. So out of the 9, there were 3 that missed the mark on that for that quarter's data. So they were at 67% for the level 2s. For level 3s, there were 10 centers. There was 1 center that was late with the download. All centers submitted their OTCPE timely. The trauma surgeon response rate dropped to 80%, which is still meeting our standard, and the record closure rate was 100%. The level 4s, we have 9 level 4s. 78% of the level 4s submitted their download timely. 89% of them submitted the OTCPE timely, and 78% of the level 4s had a record closure rate that met the 80% standard. We are still waiting on 1 quarterly report for fiscal year 2025 quarter 1, and for the TMD signature, we're still waiting on 2. So if you have any doubt of whether or not your form has been completed, please log into the LMS system and check that out, and remind your TMD if you happen to be the facility. I don't want to call out those 2. We do send reminders, and the system sends automatic emails as well. So when you see those notes, please give them your attention. For quarter 2, the report will open December 15th and will be due January 15th of 2025, and the form will close January 31st, 2025. Any questions? Hearing none, I'll turn it over to Stacy.
Good afternoon, everybody. Y'all have to deal with my little frog voice as I have a little bout of bronchitis. So I want to start by recognizing Wellstar Paulding and Piedmont Cartersville with their redesignations for their centers. Another update for our office is we have published our annual trauma registry report. It is found on our DPH website, but I will put the direct link into the chat as well. Just to summarize this year, we completed 5 consults, um, 2 level 3s and other level 4s just to prepare for their designation visits. And we are open to schedule consults for 2025. So if anybody's interested in us coming to your facility, we are happy to come and check things out for designation. Just reach out to me and we'll get you on the books. Something we did T-Quip last week, and so something for level 4s is they are going to release some standards next year. And so we're going to be looking for that to be hopefully released in March. And then that's going to be open for public comment. And then we'll kind of navigate those new standards that they're going to release next year. The OTCPE Q1, y'all have worked on that, and I'm sure you noticed that we added some new questions. The one thing that I wanted to bring up is we did put SBIRD in there, and some facilities are downloading patient information. So I just want to make sure y'all don't put PHI into your OTCPE. If you need help with what summary we're looking for with SBIRD, please reach out to me or Marie, and we can give you a sample of the Excel sheet or Word sheet that could be used. And you can also download your summary from your registry if you're keeping up with it that way in your registry. And then a couple other updates for the, let's see, sorry, I had to switch screens. The 2025 Georgia Trauma Registry criteria will be aligned with the 2025 NTDS criteria. The 2025 annual registry maintenance is complete for facility IDs and EMS provider IDs for the new ESO registry platform and the ESO V5 registry. I want to thank Marie for working on that. I know that was a lot of work to re-enter in all the facilities and all the EMS providers for the new spreadsheet for the new ESO. The 2025 image trend patient registry data dictionary was sent to ESO. The 2025 schema for Office of EMS and trauma will include the NTDS, the ITDX, and the 41 Georgia extension fields. We are working with Grady with this new ESO platform. There are a few technical issues that they are having, and we're helping support them through that transition. And then hopefully ESO will get the kinks worked out for when everybody joins. And that's all I have for today. Oh, well, I will say one more thing. We do want the OTCPEs to be beneficial to the facility. So if anybody has any recommendations or something that you think would be beneficial, please let me know, because we're open to this to be a good thing for y'all and us. So if something, a field is hard to fill out or something doesn't make sense, please let us know so we can edit those and make it successful.
This is April. I just want to add to that, Stacy, for everybody. Any new additions that you're seeing in the OTCPE, we are going to try to consolidate the biggest deficiencies that we've seen throughout the year from either the ACS visits or the state designation visits. And SBIRT being one that, we all know it kind of caught everybody off guard, was one of those things that people were getting hit with all the ACS visits. So we're just going to be adding things to that OTCPE to keep those high level deficiencies in the forefront of your mind as we see them come across, just so that you know that you need to be tracking it, learning how to track it, and be prepared for when your visit comes up. And so each time one opens, if we see that something has been kind of a consistent problem around the state, we'll probably be adding those in and tweaking things so that we can make sure that everybody's better prepared for their visits. That's all.
Hey, this is Tracy. So are you saying that each quarter we could see something new in that quarterly report, or is that only gonna change once a year, but that you will be maybe bringing up things that seem to be problematic for centers in Georgia?
I think we were looking to have it evolve each year, not quarterly, but annually. Any big red flags that we saw that maybe it's just a way to keep everybody on track so that they know ahead of time what could potentially trip them up. And not that you're not aware, but I think some of the centers just what we saw is that you're doing the work, but it was learning how to show it for the ACS reviewers. So hopefully, with it being part of the OTCPE process, by the time ACS comes or by the time we come, all of that is already ironed out. But it could evolve each year. Maybe, not quarterly. I think that would be too excessive.
Yeah, is there a way, maybe like in May or June, before the new OCTPE shows up, you can let us know if something new has been added or changed? Because it just took us off guard. You have things sometimes in the works, but not finished, or it's in, being updated, and then all of a sudden you realize you got to have it updated by a certain date, and it's sooner than you thought it had to be. So, but if you could give us a couple of months warning, that would be helpful at the center level.
Yeah, absolutely. And we'd love y'all's input too, to see if there's something that, you think could be added. Because, we don't want to just collect data just to be collecting data. It's, it's really a tool just to make sure that we're all going to be successful. So any advice that y'all have, we can certainly, before we make those changes, send them out for review to see if anybody has any questions, additions, or concerns.
Okay, thank you. Ms. Cheryl, you're next for the foundation. It's over there by Liz.
Okay, let's go over. Hello, everybody. Just giving you an update from the foundation, and usually Tracy has to fuss at me every time we meet and say, well, there may be some new people. Can you tell them who the foundation is and what you do? So even though there might not be new people today.
Actually, Tracy forgot to do that, and
Yeah.
I didn't give Lynn time to do that, so you can do it now.
Okay.
But you're not new, but
Yeah.
it's good to reintroduce.
Right. I just want to share that the foundation is here to invest in trauma care. In the state of Georgia, we're really the philanthropic arm to the system. And we work alongside the commission and other trauma stakeholders to provide resources that help advance trauma care in the state. And one of the ways that we are currently doing this is to offer some grant awards. And for those of you who are in the room today, you have some information in front of you about that. The grant application period is still open. It's open until the end of this month. We are funding 8 awards up to $10,000 each. The projects should help to improve trauma care. The initiatives can be focused on injury prevention, trauma education, public awareness, and advocacy. We also will consider other mission-related projects. If you look at your flyer, it has a QR code on there. If you need additional information on the grant itself, as well as the link to apply for funding, just scan the QR code and you can find it there. In addition, what you will find on the flyer is information on Georgia Gives. This year, Georgia Gives on Giving Tuesday is in a couple of weeks. It's on December the 3rd. What we're funding this year is Stop the Bleed kits. The kits, as most of you probably know in here, were already in high demand, but there's an even greater demand for the kits now since the shooting at Appalachia High. So we are encouraging all of you in the room to contribute, as well as make sure that you share the information with your family, your friends, your coworkers. This campaign is really conducted through social media. I know I've talked with several of you today, and you told me that you have already been sharing the information, so just please continue to share. One of the things that you should take note of is, even though this campaign is really for Giving Tuesday, you can go ahead and give now if you'd like, because early giving has started. So we appreciate everyone's support on that. In addition to what you will have in front of you today is information on Trauma Awareness Day. It's coming up on January the 28th at the state capitol. We are asking all of you to join us if possible. We want to make sure that all of the trauma centers have someone there and that you're represented. It'll give you a time to connect with your state senator or your representative. It is an early start. The legislators have requested an early start because of their specific schedule. So it's going to be a breakfast program, and then it'll be followed by an opportunity to meet with your state representative. If you look on the flyer, another QR code there, the event is free to attend, but we do need you to register because we have to figure out how many people we need to provide breakfast for. So if you could do that, that would be fantastic. Also, most of you, or not most of you, but many of you in the room today were in attendance at Porsche when we had an event earlier this year. So we want to ask you now to mark your calendar, save the date for the next one. It's coming up on Saturday, May the 17th. This next one will be at the Georgia Aquarium. So it'll be lots of fun, and we want to hopefully see all of you there. I want to give you an update on the Trauma Resource Library that is located on our website. We have worked with GCTE to review and update the documents that are listed there. Everything that you all wanted to have removed has been removed. I need you to either upload new documents that you would like to share or send that to us so that we can upload those docs for you. We want to make sure that the library contains all the resources that you currently need or things that you would like to share with others in the system. And I have a couple of reminders for you. We have 2 active projects that play a key role in education across the state. The first one is SEED, that is our continuing education instructors database. It's a one-stop shop for you. So if you're looking for instructors for various courses, you can go there. The courses that we currently are coordinating are ENPC, TNCC, and RTTDC. We would like for all educators to be a part of the database. So if you've been listed and your certification has expired, we will be reaching out to you so that you can update your information. If you're not a part, we would certainly love to include you. You can see me for more information on how you can be included in the database. So just a reminder, this particular project is grant funded. If the database is not used, it will cease to exist. And I know when we were discussing this initially, there were a lot of you who indicated an interest. When I have to provide a grant report on this quarterly, we send in information on who accesses, not by individual, but if your facility accesses the database, we know that. And so we can see how many times it is accessed, and it is underused at this time. So we just want to make sure this is a resource that you all need and will take advantage of, and using it will indicate that. And the last project we have going on right now is the Rural Continuing Education Program. We use the database I just referred to, SEED. We use SEED to find instructors for these courses. And if you don't recall what RCEP, or the Rural Continuing Education Program, is about, it's an initiative that provides continuing education courses for free And it is for those who are employed at either our rural or critical access hospitals. Currently, we have, as I mentioned earlier, ENPC, TNCC, and RTTDC courses that are ongoing. You can find the courses that are currently being offered on our website. So go there to find any of the current listings. We plan to add ATLS in the very near future. So if your facility would like to host ATLS, or you can help us in making that course possible, then please let me know. Yes,
So
ma'am.
will you share the web address for SEED and for that rural trauma education program?
Everything is on our website. So Georgia, all of this is spelled out, georgiatraumafoundation.org. And if you just go to the menu, you click on that, you'll see everything listed there. If you're looking for faculty, it'll say find course faculty. That'll be listed there.
And
okay.
SEED, CEID, what does it stand for?
Continuing Educator Instruction Database, or Continuing Education, Instructors Database, SEED.
Thank you.
Any additional questions? Thanks.
Thank you. You've been busy.
Yes.
Gina.
Okay. My brain's a little mush. We just completed just a little bit ago, our fall GQuit meeting, and, it was a really great meeting. We had a lot of participation, so I did enjoy that very much. So I look forward to, what we have coming down the pike. So I think you'll, see some exciting things coming out of GQuit, in the next year or so. So look forward to that. I think the big thing for this group is the 2025 data dictionary. That is November, almost December, and 2025 will be here before we know it. An update on that, it is done, it is complete.
When you talk about the data dictionary, just for clarification, are you talking about mapping stuff? Or are you talking about the actual definition of what goes in?
I'm talking about the actual data dictionary that will be shared with all the centers
So-
to use. But it does involve the mapping and everything, so there
Right,
are
but does
pieces
it
and
have
parts
the
to that.
definition of what should go into the spot?
Yes,
Okay, good.
yes. So, because you can't have one without the other.
Right.
So the dictionary is a key piece to provide to the vendors, to ESO, to do, the mapping for the downloads for 2025.
Right.
For that, so that piece has to be done. So they had the GFoot dictionary since end of October, I believe. There were, a good many changes. I have an FAQ sheet. They're not huge changes. They won't be big changes for the registrars. I have met with ESO, for some clarifications, and that's the reason why I have not, distributed the data dictionary, because they have to get back to me, because there is one page that they are gonna have to clarify some things. So I cannot distribute it until they clarify, whether the changes to the pick list. There was a pick list for EMS procedures, that we were going to update. And hopefully add, some procedures to be captured as a requirement, like tourniquets and needle decompressions. That was it. So we updated the pink list and took some things like mass trousers off of it, like, because when's the last time we saw those, right? So Chris Michelle helped me clean up that pink list. We didn't think it would be an issue, but the engineers came back to ESO and thought it might be an issue of changing that pick list. So if we can't change the pick list, then that makes that whole page for naught. So I can't, they're supposed to get back to me ASAP on that.
So ASAP, like, can we get like a maybe some kind of date around that, since we're
that I
getting the
hear from them
holidays?
this week.
Okay,
So TQuip kind of put a They were all at TQIP. I had a conversation with Julie, Holland, which is the trauma compliance person, for that. So they've been on top of it. So I'm hoping that I will hear back from them this week, if not the first of next week. So the FAQ is ready to roll out. The dictionary is ready to roll out and be submitted. I've actually done an Excel spreadsheet with all the required data points for everybody. So I'm hoping it will be easy when we send it out. I actually part it down. It's much smaller. I try to organize it in required data fields and non-required data fields. So it's ready to roll as soon as I get that clarification. But until we know that that pick list can be updated, I just can't send it out. So that's the hold, on it going out. So I'm hoping by the 1st of December, I'll be able to send it out.
Okay.
So it is ready.
Thank you.
So, and as far as the update, I think everybody should be getting their update for 2025 for the national stuff. I think because mine's scheduled for the central site for tomorrow morning, I believe. With the new fields, the ACS fields. So you should be getting an email from ESO, so they're a little bit in front of those because there are new NTDS fields to be seen. So I don't know the timeline. Usually once the dictionary is finalized and everything's approved, they say it's a 90 to 180 days to get the state updates out. So we'll see.
So will we be expected, if we don't have the software updated, to go back and re-enter if we've gone past?
We'll see. I
patients?
mean, we always struggle with this every year, right? It's usually somewhere around April or May before we get that state update, and that's just unfortunately the way the timeline works. The national update comes first. So, but that's the big thing from GQuip on that. And then download is due 1st of December. So we got one of those coming up. So just remember that. And I know that Gabby has registration information will start going out for the 2025 winter GQuip meeting here shortly. So after we just finished up that. So I think that's the main thing for GQuip.
Is that in February? February.
Tracy and Gina, just one thing I just thought about last year when we did some changes with the Georgia recommended changes, those that were on the old V5 system. Remember, it's so outdated, or they're not making any changes to it. We kind of broke the system. So are we mindful of that
Yes.
moving forward?
These are just pick lists and not additional fields. So the additional fields are kind of what like broke it. So there'll be no I'm trying to think of the term, validation rules. So the validation rules kind of break things a little bit with it. And they explained it to, and this kind of helped in my head. The V5 is very like form based. So like pick lists are kind of typically like, or easy to change. Because they just go in and kind of add or change the form. And so I don't know why that procedure list is being a little bit more troublesome. But adding a field like we did with the organ donation fields, that's why that was so troublesome. So there will be no adding of new fields ever. But the pick list or like if we change the admit service list, that's a little bit easier because it's really just form based. So we updated the pre-hospital med list and the pre-hospital procedure list. That was it, because we added blood products to the pre-hospital medication list. And made those changes to the pre-hospital procedure list. Those were actually the only changes. Because we need to be able to capture pre-hospital blood better than.
So is that, and that's the main reason, just for the blood? That's all we're gonna capture?
Yes.
Okay.
So the only thing in there now is it just says blood.
Okay.
So, the centers that do have, pre-hospital, agencies carrying blood, it makes it very difficult to capture that, and they're having to put it in the notes. So what we added was whole blood, packed red blood cells, plasma, and platelets. 1 unit, 2 unit, like with different, so they can not have to add it to the notes. It's also gonna be great for us to be able to collect that data.
Mhm. Thank you. Circling back around.
So before we move on, let's go back up a little bit. Do we have any new members in the room that's never been to one of our meetings? Anybody?
I'm on the call. I'm Melissa Hungerford from Win Army at Fort Stewart.
Oh. Welcome. Is anybody else on the call? This is their first time calling in?
This is Paige Hernandez from Grady Memorial. This is my first time.
Welcome.
And this is Brett Gunner at Piedmont Augusta.
This is Nadine Lynch from the burn program, Wellstar Cobb Hospital in Austell, Georgia.
Well, welcome to the group. We're glad to have y'all and hope to see you in person soon.
Does anybody want to share upcoming survey dates? That you're stressing out about?
I'll share, Northside Hospital, we're due for ours April 24th and 25th. So we'll take all prayers. Any guidance or tips for those of you that have gone through, we'll welcome those as well. We're gonna do great.
Okay, and I'd like to, I know I'm behind the 8 ball, or I've been behind the surgical scalpel more in the last year, but Tracy Johns, and I'll be rotating off this year as leader, but Jessica being the trauma program manager, have you already been to a state meeting where you were program manager and I just missed it?
I don't think so, no.
Well, congratulations and welcome. You had T-Quip already. So Jessie has gone on to greener pastures. Agro farm marketing. Yes. And then I would like everybody to say hello to Josie Fabico Doolin. You know her as our lead trauma program specialist, but as of January, she'll be the director of trauma services at Navicent. So, well-deserved promotion. And I've been her boss for the last 8 years, so starting in January, she's gonna be my boss. So payback. Okay.
And what are you doing, Tracy?
I will be the manager of surgery and trauma research. And I have a very competent and wonderful Kesha Patel, who is working with us as our clinical research coordinator. And so right now we have 6 surgery research studies going on and in the talks for 2 or 3 more. So I love this stuff. Yeah. Yeah. That's what it takes to be a data geek, you know? So thank you. I guess we'll move on to our subcommittee reports. Kendra, are you on the line with us for education?
I am. Can you hear me?
Yes, if you'll speak up just a little bit more.
Okay, perfect. How's this?
That's great.
Okay. So the Education Committee is very excited that we have finished the Trauma Program Manager Toolkit and the Burn Program Manager Toolkit. We've made it into sort of one combined document to try and help all of our team members throughout the state. I've sent it to the entire Education Committee and all of the GCTE committee leads are the subcommittee
Chairs.
The chairs, thank you. And I've sent it to some of our nursing colleagues on at the Georgia Trauma Commission. So I'm hoping for some feedback. I've not gotten any feedback yet. So at this point, our GCTE education meeting is the Tuesday right after Thanksgiving. If I haven't gotten any feedback from it, from anybody by that time, I'm just going to go ahead and present it for final approval at the education subcommittee. And then once that's done, Cheryl, I would love to be able to put that onto the Georgia Trauma Foundation resource library. So if we can connect at a different time, if you can help me know how to upload that to the library, it's going to be a living document. So we'll make changes to it as things change around the state. So hopefully it will just continue to be an active, useful resource for folks within the trauma community here in Georgia. Likewise, I'm also very excited to say that the Essential Skills Toolkit for non-trauma hospitals is also complete. I'm just formatting it from a blank PowerPoint template to one that's a little bit more representative of the GCTE and Georgia trauma efforts within the state, that to try and make it a little bit more, quote, branded, if you want to call it that. But so that again will be submitted for vote by the GCTE for approval, final approval at our December meeting if we don't get any more feedback about that, any changes or concerns about that. So those are two big projects we've been working on. We're very excited to see that we've actually been able to accomplish this, that they're finished, just waiting for team approval. So yay, Education Committee. Thank you so much for all of your help. Another thing that we are working on is the Society of Trauma Nurses we've had for a long time access to the Society of Trauma Nurses e-library of trauma education modules. Instead of having to have centers purchase them individually, the education subcommittee has had access to the entire set, and we've been able to share them with trauma centers around the state. So that's been the centers who've participated in that. It's been well received and appreciated. I still want to make sure that everybody knows that we have access to that. And if you are interested in getting access for your hospital, I can send them to you. If you will just send me an email, you'll need to just fill out a very brief MOU about how you're going to use the e-library modules, that you're not going to share them outside of your your trauma program, that they'll be within your trauma center. So just reach out to me. I'll put my email in the chat, and then I can send you the modules once I've gotten your MOU back. But a new thing that the Society of Trauma Nurses has come out with, and I think it's a fantastic resource, is a set of orientation modules that centers can use the baseline information provided by the Society of Trauma Nurses, and then add some of their hospital or program specific information for that as well. I've looked at it, if you're a little superficially, I haven't gotten into the weeds with it yet, but it looks like it might also be an excellent supplement to our education subcommittee, what we make available to the trauma centers in the state. So I'm looking at whether it would be feasible and useful for us to, again, approach STN about a group or access to it, like we have for the e-library. So the folks that I've talked to so far have been fairly receptive. There are a couple of questions, but we're gonna try and find out the specific answers to those questions, get more information available, and we will talk about it more in depth at our December Education Subcommittee meeting as well. So that is my most significant update. I just wanted to also let everybody know that as of the beginning of the year, we're going to be in our reporting year again. So I'm actually going to hand off the chair of the Education Committee role to our vice chair, who is Julie Freeman Mosher over at Kennestone. So I will make sure that she is up to date and ready to take over as the education chair after January 1st. So thank you. It's been a real honor to serve in this role, and I just appreciate the team that I've been able to serve with. So that's it. Thank you.
Thanks, Kendra. One of the things I had put in for my report to the Georgia Trauma Commission tomorrow, and sounds like I might need to hold back on this, is purchasing the orientation modules. Sounds like you want to do a little more investigation before we decide to purchase that, or make sure that they would allow us to use that the same way.
So I have
Liz?
talked with Society of Trauma Nurses, and they are willing to let us have sort of the group access with one umbrella MOU with Society of Trauma Nurses. That doesn't look like it's going to be a problem. I think one of the questions was, is this going to be just too much information at once? Or are we able to subdivide the modules into smaller chunks for people to access and review? Not all at one time, not have like a death by PowerPoint overwhelming experience. So I have been told that we are not able to break them up as individual modules like we are able to with the e-library, but I want to get a little bit more information and find out what exactly, how large that orientation set of modules is, how long they're sort of anticipated to take the average user to complete them. And I haven't gotten that information back yet, but that is something I'm looking to. I'd really be grateful if we could just get a general nod from the Trauma Commission about whether this would be something they would be supportive of. And then once I get the final answers, I can let you know or let Lynn know, and hopefully we'll be able to finalize that moving forward.
I think the general dollar amount shouldn't break the bank.
Yeah.
So I just want to make sure if I should go ahead and make that recommendation, but usually they're always looking for just little amounts to spend or finish things off. So that might be okay. I just want to make sure you want me to still make that request to the commission
Please
tomorrow.
do. Yeah,
Okay.
I would be grateful if you would. And I'm going to reach back out to STN today to just see if I can get a little bit more of those final questions answered. We've all just been kind of running like crazy since the beginning of November. So I'm hoping I can have that final set of answers for you tomorrow.
Okay.
Thanks, Tracy.
Tracy, I think some of the questions were in light of the survey, education survey that got done, and looking at, I think a lot of areas that people are moving away from, the PowerPoint, and the data,
right,
and the titles, and is that, although yes, the price point's very low for this, I think as a group, we have to decide, it's gonna be hard, maybe we can get a little sample, but, and I'll throw this out just for discussion. Is this something that would be of interest for everybody to use as their baseline education? If there's 18 chapters of content that's all PowerPoint based with quizzes, we all now have to do our annual updates with these PowerPoints, and come on, let's
be honest, right? You put it on play. You know, you do the quiz or you sign the attestation. We're not really helping people to assimilate or integrate the knowledge. So is that the best way for us to approach it? And it may be, but I think we need to have a more global discussion about what's the best way to do some baseline. If we're gonna have a state baseline education for trauma care, what does that really look like? And what are those core concepts and core bases that we want to make sure everybody has? And like Keystone has, and the other centers that Wellstar as a whole, I think Keystone started, has, you know, trauma orientation, that Carrie put together. And it's really good, is that, you know, do we want to kind of look at expanding some of that and sharing some of those ideas? There's probably other centers that have that too. What's the same? What's different?
So would it be
More along the lines of, sure, this is an easy checkbox to say we have a DISC or a, you know, cloud-based education program that we can push out, but is it really gonna impact the way we want it to impact what we do, or do we have more hands-on skills-based checkoffs and things like that? Yes, president of STM.
I saw the slides. They are really good, and I do think you're allowed to, they leave room, it's more of a, why I think it would be a good complement to e-library is it's more of a practical, like clinical orientation, and it was developed with rural in mind. So it's, to me, it was I was actually pleasantly surprised when I looked at it. I thought, oh, this is good. So
I was thinking just as a resource too, to kind of, as a reference.
Right.
Yeah.
That was the way I sort of envisioned it, is something that we could make available. It wouldn't necessarily be mandatory, but especially for these, you know, these smaller centers or these smaller programs, to at least have them be able to have a foundation that is, you know, current evidence-based, it's high quality, to be able to use that to begin their trauma education, their trauma orientation process, and then they could go ahead and further, you know, specialize it according to their center and their center's needs, you know, have the actual skills checkoffs, have the you know, practical component. But in terms of just sheer information, I thought this was a good starting point.
and we would get it cheaper if we buy it for the state than everybody who wanted to buy it individually. So while they don't have anybody interested in that, like, let's maybe get on it. I did just email and text Stephanie to say, just they give us a number so we can put a placeholder in it. It would be helpful for you to at least get that placeholder.
So,
If you decide you don't want it, use it for something else.
So what? It's a good thing, but I do think it lends itself to a conversation, and we do have a statewide system. Do we have a statewide expectation of a minimum skill set or skill base?
Or a minimum standard
A
of
minimum standard of
education.
education.
competencies or something.
Yeah, do we want those to go hand in hand? And then, you know, this could be a resource that walks along with TNCC and ACTN and the other components or simulation-based training in our, you know, kind of like that. Do we want to look at it from that perspective, not in isolation? We talk about different resources, but do we need to be talking about moving in that direction of what's our state baseline?
So I guess what I could do is maybe take out the amount, because we really don't know the amount, but just say that that's something we're interested in. And we'd like to just propose that, put it forward as, like you said, as a placeholder, and explore that a little bit further.
So Tracy, I've been told that that amount that I put in is the amount, even if we get like a group license. It's not going to be more expensive. I specifically clarified that.
Okay. Thanks, Kendra.
Thank you.
$199.
How much?
$199.
It's like $199.
Yeah.
The whole state?
Yes, it's fantastic.
Now I'm still the chair of our You might want to wait until the day.
All right, hey, everybody, can you hear me? All right, this little report out of the, yeah.
No, I was gonna say, introduce yourself, so
Oh, I'm
people in
Kathy
TV
Roger.
land or
I'm the chair of the pediatric subcommittee.
Kelly Roker,
Yes.
the one and
I'm-
only.
And I'm not a doctor. I am- all right, so some of the projects that the pediatric subcommittee's been working on, SIPA is an ongoing project, the shock index pediatric adjusted score. Education went out to every center in the state. And if you didn't get education on SIPA, if you didn't get a packet, then please get in touch with me and I'll be happy to get you whatever you want to know about SIPA. I will make sure you know. We did have a request from Northside Gwinnett for additional education, so we need to set up a time with them where we can get with their folks and do some additional education, and any other center who would like for anybody from our subcommittee to come and do education on SIPA for any of your physicians or practitioners will be more than happy to arrange that as well.
Do you do that for EMS also?
Yes, actually, we recently, I think we had 3 talks at EMS trauma symposiums, and SIPA was incorporated into all 3. So,
oh, excellent.
Yes, they weren't all necessarily SIPA focused, but I made sure that they had
They got a plug?
had a SIPA plug in there. Yes, so we are doing education for EMS as well. Pediatric transfers, so in coordination with the education subcommittee, who is looking at timely transfers, pediatric subcommittee is looking at pediatric transfer rationale. So we're collaborating with that subcommittee to create a pediatric transfer toolkit for the state of Georgia. And I know there had been some questions from this group before about the STN transfer toolkit. And that's what we're modeling this after, but that STN transfer toolkit is from 2014 or 15. So it's pretty outdated when we looked through it. And we have a lot of, specific, we have a couple of pediatric centers that people are transferring kids into, and we all do things pretty similarly in this state. So we've already looked at that. So it just makes sense for us to be able to put some things in the transfer toolkit, like the things we see going home from the ED often. So if a kid gets sent up from Macon with a linear skull fracture, and they're in our hospital for 30 minutes so that neurosurgery can come and give them their blessing and send them back out the door. Just that time on the highway is dangerous, just as dangerous as the child that just fell off the bed. So I think if we put state specific things like that, especially what all of our pediatric centers are seeing, it will help. Yep, all your centers from.
And I just thought of something that's in the pediatric readiness guideline is making sure that you can hand families directions so if that's something that the pediatric centers have the directions to your hospital or, how to go in there. If you could go ahead and do that for all 3 pediatric trauma centers, that would be helpful in our gap analysis to kind of plug that in and make sure that, if we do have to transfer, we can say, here are the directions or here's the phone number, that kind of stuff. And that would be helpful. Can you tell we just had a meeting?
Yeah, it would actually be helpful for me to have directions to Arthur and Blank, because once I hit that campus, I don't know where the heck I'm going. And sometimes the ambulances don't either.
Well, that would help me remember the new name too.
Probably be good for everyone.
Yeah.
Sections are assigned to committee members and, in between all of our visits and everything else that has come up, and now the holidays, we're slowly trying to get through them. But Kendra, if you have any suggestions about how you got your sections done so quickly, I'd love to hear them. So the other thing that we have been talking about is whole blood transfusion. And I know that a lot of the pediatric centers are having meetings to discuss use of whole blood, but there's just not been a lot of studies out there other than from the University of Pittsburgh. CHO is about to be involved. We're starting the very first week of January in the MATIC-2 study. So there are, I think, 4 or 6 arms of this study, and Scottish Rite is actually going to be in the whole blood arm, and ANBH is going to be in the component therapy arm. And then I think after 6 months or something like that, then we get a new arm. All that to be said is after we're in collaboration with, I think there's many other pediatric hospitals across the country. So I don't think it's going to take very long to get information about pediatrics and whole blood, and for us to just be able to say confidently that it is safe to use whole blood in children, but more to come on that. So that's pretty exciting. I think that'll be great for the state. We have a lot of EMS agencies that reach out and ask us questions about, age cutoffs and everything, because, a lot of EMS agencies are carrying whole blood or are going to want to go to carrying whole blood, and we just don't have the answers to those questions right now. So hopefully we will soon. And then EMS Safe Transport Project, we were able to get a QR code, and it is available if any centers are interested in helping to collect information on EMS crews who might be bringing pediatric patients to your center, not transported in age-appropriate safety restraints. We're more than happy to share that QR code, and I don't mind being the one to collect that data. So other than having people at your center scan the QR code, the data will get uploaded to a RedCap tool, and I don't mind being the keeper of that data and the tallying of that data.
Could you share the QR code with, Gabby, and she can put that in the minutes? And that way everybody will be sure to get a copy of that QR code. Because I think we'd all want to just help contribute as we can.
Okay. And if you have any EMS agencies that need more education or resources on safe transport, then we'd be happy to share what we have, because we've compiled a lot. So that's it. Thank you. Okay.
Oh. Rainbow, process improvement.
Good afternoon, everyone. Can everybody hear me?
Yes, thank you.
All right. So the PI committee has continued to work on our time to definitive care. It's been kind of ongoing for a while, but we have done several surveys with the committee members to establish timeframes for transfers out of emergent and urgent patients. We got a lot of good information back. We're looking at pulling our information. Tracy's going to get it to me for the lit reviews that we did. I have the ones I did, and a lot of places did define theirs, and it was in line with what our members gave us input on as far as timeframes. We looked at their field triage criteria and sent that out to everybody to try and utilize that with our definitions. And then we've also worked with, some of us on the committee have also been on the state time to care work group as well. So we want to align with them. With that said, we did have a recommendation that if you could take it forward to help us kind of keep this moving, so we're not just talking about the same thing every time, of 120 minutes for our emergent patients and getting them transferred out. And then 240 minutes was our recommendation for urgent. And then, go to the other committees to see if they agree with that, and if we can make this something that's a state thing, and then we'll continue on with, the way to help everybody get it rolling and be doing the same thing at all the facilities. And then I would just ask Kelly, I did not realize that you guys were doing a pediatric transfer time thing. If you could share some of your information with us, because nobody's shared that on our PI subcommittee meeting on the same kind of topic. So if you could share that, so we're all on the same page with that kind of stuff too. We can keep it with all of our information
Yeah, that document is in its infancy. It's still in, coming along in sections, and we've not really talked about a time, but I'm pretty sure that we don't have a different time frame than what the adults are trying to shoot for.
Okay.
And yeah, I don't think there's a different recommendation, but I think our main focus is transfer rationale. And we're gonna make sure that that is shared with everyone.
Yes, and when I do share the lit review stuff, some of it is actually in limbo when I try to move it from one team's folder to the other. So that's part of my hang up right now, but Kelly actually reviewed some pediatric articles too. So that'll be in there with that. So I haven't been ignoring you. I just got to get IT to help me find where they are.
I still have mine that I did, so I at least have those four right now. So I knew what my review was, so I could include it in our stuff that we've been doing. So, and then our other project that we just kind of brought it forward is we've asked centers who've had their verification under the new standards to share information to help with that. Any tools that they use to streamline the process, any things that they learned from their actual verification that others need to know. We did get some information from TQIP, I think, that will help us with this as well. And then if the state, I heard April say the state is working on that as well. I think those are all good things. We can work together as a team and get these things put. We want to put it on the website to have as a tool that everybody can utilize.
Is this
So
about
we're waiting for people to share that information with us so we can start to get those resources going? But we just started on that at our last meeting.
All right, thank you.
And that's all I got.
Hey, Tracy, I have a question. Rayma, if you can hear me, can you clarify on the recommendation for the emergent and non-emergent comms?
Ask Gina if you can use the.
Oh, sorry.
Yes, do.
Hey, Rayma,
Yeah.
just clarification on the recommendation is made for the emergent and non-emergent transports. Can you clarify on that 120-minute time frame for the emergent transfers? Is that door like arrival to departure or decision to departure? Just so that way we can make sure that we're understanding what you're asking.
That was arrival to departure is what we had spoken about.
Hey, Rayma.
Yes.
Sorry, this is Kendra. I didn't know if you knew, but I think it was probably 2 years ago now, the education subcommittee did a project on this and actually put together a PowerPoint for hospitals to use with their referring facilities so that they could they could help educate the centers that were sending trauma patients out. And I'm happy to send you a copy of that as well, if you think it would be useful.
Absolutely. I would love to have that.
Perfect. Perfect. Thank you.
Thank you so much.
And would you also send that to Cheryl too, so she can put it in our new handy dandy place of honor?
Absolutely. I'll send that out and the project that we did last year.
Okay. Kelly, you want to start with the registry?
Can you hear me? Don't hear me? So I'm Kelly Vaughn. I'm the chair of the registry subcommittee, and we met in October. So to give you an update, we've received funding from the Trauma Commission for 2 different courses. First, we did the AIS 2008 course, and we got everyone through that. So this current year, we received money for the AIS 2015 update. So just so everyone is clear, we have had 57 participants register. The course is online and it's self-paced. So you can sign up for October, November, or December. So of course, people are still taking those courses, but we'll wrap up in December. So thanks to the commission for funding for that. we will look at moving forward what we want to do next year as far as registry education. So I think we have ALS kind of handled for a couple of years. So it'll either be a registry course or the ICD-10. I'm not really sure where we'll go from there. It will be, I mean, those are things that are part of your ACS verifications compliance. And so it will be one of those. I'm just not sure which.
You may want to go ahead and decide and get it in. When do they make their budget decisions, Liz? For the
It's
coming
gonna
year?
be soon because, we just need placeholders. It doesn't have to be.
So if you had a
I'll
kind
get
of an
costs.
amount, you
I'll
know,
get costs together. That's
okay,
not too
yeah.
difficult. We'll
Because
figure
it'd
out.
be January or February, something around there.
Yeah.
Okay.
So that's moving forward. Gina's mentioned and Marie mentioned the data dictionary. The other thing that has evolved over this past year with the registry group, as we've met, people are starting to submit questions. And then, so during the registry meetings, we're discussing clarifications or issues people have, talking through how we code things, presenting cases. And from that, it was decided that we build this Excel document, which I've shared with the leaders, but I haven't shared with the group. I showed it at the registry subcommittee meeting in October, but basically it's an Excel workbook with every tab being a tab in your registry. And as people have brought up questions in the registry subcommittee, as we've talked it through, whether it's a TQIP clarification, something maybe Gina or Maria has given us guidance on, it's going under the tab of the registry. Wherever it's found in the registry, you go in this workbook and look under the tab and you'll see the date, what was decided, any kind of recommendations. I've got screenshots from things. So I sent it out to just the leaders. The idea being this also is a living document that maybe we can send to Cheryl. And as the registry chair, after every meeting, which is only quarterly, that document will be updated. And that just helps everyone, I think, moving forward.
And if I can suggest even adding a PRQ tab, because we're not due until April of 26, but they ask for a, what is, I can't remember what they call it, but your registry something report. And I kept looking for a template. They don't have a template. So I said, well, what is this registry report? She said, well, it's whatever you make it. It's almost like the State of the Union. You know, how many MIDs did you have? How many total patients did you see? How many? So it's almost like something I send to the C-suite, you know, maybe with a couple of little added on additions. So everybody's might be different, but it's like, oh, okay, that, you know, that gives you an idea, but most people aren't going to know, and they're going to have to write them and ask them, what does this mean? Now, they might come back later and specify something a little bit more, but at least that was a beginning for us.
Okay. The other thing that hot off the press, that's why I keep referring to my phone. Colleen emailed me, and this was yesterday, and said that she re-downloaded their second quarter for TQIP, and she got an error message of level 1 and 2 errors. And she said if anyone else has issues, she had to manually pick TQIP or TQIP without process measures. So I asked her what the issue was. Like, did she ask TQIP for clarification? And she came back and said, TQIP responded and said, unfortunately, there is an issue with our system where it's making you select your choice instead of auto-selecting the option you picked last time. We are working to get this corrected as quickly as possible, but for the time being, it's going to ask you to select the option TQIP or TQIP without process measures. Once you select that option and resubmit your file, I expect you will have information that populates on your validation summary report. If you have any questions, please reach out. So I'm going to forward this email to all the centers because I know we all have downloads due. And I just want to make sure everybody understands you may get
something like
You
that.
may get tied up with this. So,
Always something.
always something. And I think that's all I have.
I'll do crystals. I'll do crystals on the injury prevention. So back in July and August, they did the back to school, start to bleed webinars across Georgia, and they had over 1,500 participants in those webinars. The Fall Spree Fridays and Fall Prevention Month in September highlighted the Georgia trauma systems, the bingo sides, and the fall prevention initiatives for EMS and fire. I don't know if any of y'all watched those. But I had no idea that the collaboration with hospitals and fire departments with the fall prevention, that to me, which was very interesting, gave me lots of ideas. So I think that was really great. And then this past Monday, November the 18th, was National Injury Prevention Day. And Emily Burnside from Memorial Health Savannah did a webinar on ATV safety that evening for the public. That's all she had.
Okay, thank you. So we'll be moving into new business. We have some voting to do. This will be, we will need to vote for a new GCTE vice chair. After this meeting, Lynn Grant will move up to chair, and we need to vote for somebody to be her vice chair. We've had 2 people nominated. So if you will use the QR code that's provided for you on the screen, it's with Mentimeter or menti.com, and then select your choice.
It will keep
It's not centered or
It's,
yeah, it's
Oh, the Zoom people's names, like the little TV screen. You can't even see it on your side. We just go there and look. Yeah, so, yeah. There, got it.
always serving.
That's okay.
Okay, since waiting for a presenter.
Good. Ready?
Ready? While we wait, Lynn will hum the Jeopardy thing.
I hate Jeopardy because when I was in labor with my first child, that was on TV. 5 song. There you go. PTSD.
So we're ready.
Okay.
So it's a simple majority or?
Simple majority.
Okay.
So that's Kendra Holt.
Kendra?
Mm-hmm.
Okay. All right. Well, congratulations, Kendra. Congratulations, Kendra.
Thank you, I think.
And your dad here.
Is the meeting dates.
Okay. The next one we vote for are meeting dates. Okay.
Where are the dates?
They were in the packet that was sent out.
February 19th. I got it. It's Wednesday, February 19th, Thursday at Callaway. Thursday, May 8th is a Zoom. Thursday, August 21st is hybrid to be determined. Thursday, November 6th is by Zoom.
I'm sorry.
August 21st.
I don't know. But,
And I believe the yays. Have it. So we,
What's the ACS standard question?
okay, you asked the question.
Well, I just asked, to include, since we were doing a poll. So, this past 2 years, I guess, we've been doing the ACS standards, going through and picking out a few and just kind of discussing them. And I just wanted to ask if that was helpful to everyone, if everyone can want to continue to do that for the next year or so, or until we run out standards. I don't even know how many we've done, but we've done quite a few. But
Maybe since the ACS is coming out with the new moral standards, you could do one gray book standard and then new
yeah,
moral
that's
standard.
a great
That's a great idea.
thank you.
Like, everybody
Yep.
else too?
Yay, and the yays have it. Okay. Thank you, guys. Now the next thing we're gonna do is go over some of the standards. So we've got, trauma surgeon requirement, trauma surgeon backup call, and trauma surgeon coverage. I'm gonna go over the one about the trauma surgeon requirement, which is 4.1. It's a type 2 standard. And it applies to levels 1 through 3 and both levels of pediatric trauma centers. And it's saying, which was part of a little bit of a discussion we had today in the afternoon meeting about ATLS and just having that education. But the trauma surgeon must complete an ATLS course at least once. Now, one thing I want to tell you is these are the minimum standards. So like at our facility, we have one of the other standards talks about an annual review. And so at our facility, we're a level 1 trauma center. We require all our trauma surgeons to be instructors. And I believe that's still the case. We had one person who dropped the instructor level, but then he left. So, but anyway, we just felt like that was important, and we've actually put it into the contracts of the EC providers who are staffed by a company. And every time, their contract comes up, because that medical director will call Dr. Ashley and says, do we have to be current in ATLS? And he'll say, yes, we're level 1. I want you to keep it in there. So that's what they do. But so you have to have that. You have to have privileges in general and or pediatric surgery. One of the interesting things that we learned the first time we did a survey, and we had to pull the privileges to look at, basically general surgeons are taught to be the master, have knowledge about a lot of stuff, but not necessarily the master of all, so they got to have a smattering of knowledge. So basically they can take care of and be the oversight person for all these specialties until you get somebody to come in and see them. But they have to have the privileges in general surgery and pediatric surgery. Then they also have to hold current board certification or eligibility in general surgery, or you can go through the alternate pathway. So your measures of compliance are going to be your ATLS certificate, credentialing letter, or whatever is sent through your credentialing committee, and evidence of board certification or eligibility. Are there any questions or comments about that? We'll share. Could everybody hear what I said? Because I think my microphone died partway through, but I'm such a loud mouth. Okay.
All right. So I'll review the 4.2 trauma surgeon coverage. It is a type 1 and it applies to all levels, trauma centers, adult pediatrics 1 through 3. So this is the definition is all trauma in all trauma centers, trauma surgery coverage must be continuously available. And then level 1 and 2 trauma centers, a trauma surgeon must be dedicated to a single trauma center while on call. So they can't be on call at trauma center A and at trauma center B and just hope they can cover both. And then the additional information is continuously is defined as 24/7, 365 and implies that there cannot be any gaps in coverage. I actually had an issue with this at my center recently, because my C-suite wanted to define that differently because they wanted to have my trauma surgeon take off for the weekend. I actually even called Liz, my CEO did. But in the end, I won, and he didn't let him take off.
So he loves you, right?
Yeah, he does.
For a wedding, Lynn.
Yes,
Oh
a
my
wedding.
gosh.
All the surgeons did not have to go to a wedding. But anyway, we tried. They tried. And then the measures compliance, if you haven't been through the new standards and you have to upload all these measures of compliance, which is very time consuming, but you have to, for that whole reporting period, you have to upload all your call schedules. And then they review that, of course, before they come, and then they can look at it while they're there as well. And then 4.3, trauma surgery backup call schedule. This is the type 2. So for level 1 and 2 trauma centers, they must have a published backup call schedule for trauma surgery. And then for level 3 centers, they must have a documented backup call schedule or a backup plan for trauma surgery. So speaking from a level 3, we don't have a backup call schedule. We have that one surgeon that's on call and hope, it doesn't break loose when he's there. But we have had some times where he may be in OR and we have a level 1 activation come in and he can't, stop in the middle of the OR. So we just created in our trauma services scope of policy, we'll put in there that if the trauma center is in the OR anyway to whatever cannot break free, then we expedite transfer to our closest, most appropriate trauma center. So far, that's been good. We haven't had any issues. We'll see in August when they come and survey us. But again, the measure of compliance, you have to upload those backup call schedules or your policy, your plan, whatever your plan is. I was just interested if any other level 3s had what their plan was for the backup. If you don't have a backup call schedule, if anybody else would like to share what their center does in that transfer.
Yeah. Our plan says that the surgeon on call is responsible for contacting he knows who's in town, or she knows who's in town and who isn't in town, and to get them there, because there's always 2 in town for us. So it's in and they let that go in our consultative visit. So, but it was left up to the surgeon on call, not for anybody else to have to keep up with.
We do, as a level 1, have a backup call schedule, but that stays internal. It's not released to the call desk, so that the only one who uses the call backup schedule is the trauma attendings themselves. So they know who's on backup, and because they didn't want somebody else deciding when they should be called in. They wanted just their colleagues.
We did the same thing, but we ended up having to extend it to the house supervisors at night, because that's usually sometimes when the surgeons are in the OR trying to hammer cases out. So we had to extend it to the house supervisors in the event that, so they always know when traumas are coming into the facility to try to help be that layer in case the surgeon's tied up and he can't break free. So we do the same thing.
Okay. Does anybody have anything else they want to share? I know, getting ready, you've got your survey in August, and how time flies.
Yeah.
But you talk about you know, our survey is not for until April of 26, but we've already started doing stuff for our survey. Thank goodness for Josie and her consistency. It has been an act of Congress to just get a hold of the call schedules. And we still have one specialty that we're dinking around with because, you know, they think we're, you know, it's a secret squirrel club or something, but, you know, it's not that. We just want to put it in a folder. We know we can get a hold of it, but this is the reason I'm saying this is not to make fun of that specialty or not, but don't wait to start your data collection. You know, if my data year is January 1 of 25, I'm not going to wait to get prepared January 1 of 25. You need to start early and look at the standards of what they're asking for, or talk to people. You know, Jamie was very gracious to share some things that they learned when they were getting ready. And that was one of the things she said is go ahead and start getting those schedules together because it's very tedious doing that kind of stuff. And so you hear that on webinars, but you know, when you talk to your colleagues, because it is a lot different, because they've got longer to look at your documents. So you want to be prepared when they do get your documents that it's what they want, because you know that's what they're going to go after in chart review. So does anybody have anything else that they want to share?
Hey, Lynn, can you share the massive outreach that you pulled off yesterday?
Oh, so it was yesterday. Yeah, actually, Jamie could probably talk about it better. We partner with Real Star Kennestone and the Lexi 43 Foundation. And they came to Dublin, did a Safe Drive Summit for 3 of our area high schools. And it was a really good event. We did the trauma simulation bay with Julie. She's great. And Jason, he's great too. Always have a good time with them. But what we do is the trauma-based simulation. They come in. Well, let me back up. So the Lexi 43 Foundation was founded 10 years ago. Is that how long he's been doing it? His son, anyway, was the Auburn football player that was killed in an automobile collision, was not wearing a seatbelt, so he was ejected. He was DOA, so he gets a talk, you know, tells a story. So the intent is to help high school kids with safe driving, not distracted driving, wear your seatbelt. So we simulate a trauma simulation and show them, you know, the 36 French Foley catheter and tell these boys where it's going, you know, the big chest tubes, and, you know, their eyes just, you know, they get pale. So I think it's kind of like a scare tactic. But it works. We did one last year at this time with them as well. My son was actually the patient, and he really got a lot out of it. So I appreciate y'all. That's a great program that they do across the whole state of Georgia. I think Julie said this was number 17 or 18 that y'all done. So it's really, really good.
And we had 248 people come through.
Oh,
wow. That's good. That is fantastic.
I also commend you, Lynn, for getting your CEO involved in your surgeon call schedule, and he's very involved in your orthopedic call schedule.
Oh,
John
yes.
Avery, he's amazing, and you know, having like that kind of access to your CEO is just amazing.
And he listens.
Yes, he's very
Might take a
knowledgeable.
while, but he listens.
Yeah.
Yeah.
Okay, thank you. And we'll stand adjourned.
Thank you, Tracy, and thank you, everybody.